Welcome to all of you. I want to welcome you to the White House. My name is Heather Foster. I am the Associate Director here at the White House Office of Public Engagement, and it's my job to basically do what we're doing today. Make sure that you feel connected with the White House, invite you here to attend briefings, tours, activities, and often interact with our senior leadership. So I want to welcome you here today on behalf of the President, the First Lady, Senior Advisor Valerie Jarrett. We have a wonderful morning set up of briefings. I just want to kind of walk through how we're going to run the event here today. And we are very excited that you all are all on social media. Later on this morning, you'll hear from my director, John Carson, the Director of Office of Public Engagement, and he is all about social media. He loves groups that blog, that tweet, and to just tell you a quick story, it's really important in the work that we do here and how the president gets his message out, and we use so much of it on social media, and we use so much of it on Twitter. So recently, you might have heard that the president called on Congress to make sure that they extend the payroll tax. And so back in December, we launched a campaign for a week, basically telling all of our groups to make sure that they tell what their individual story is if they have an extra $40 in their paycheck. And this went far and wide. People sent us videos, they tweeted about it, they did videos in their bathroom. It was amazing to see for so many people what $40 did. And this was the type of thing, once everyone saw how much $40 in one paycheck meant, all of a sudden we got a payroll extension. So it's amazing to see what can be done on social media. And so I just want to make sure that you guys understand our process here today. There's some key things about the White House that often make things like today complicated. Security is very tight. So once you enter into the building, you cannot enter. You cannot leave. So that is an important thing to remember. So in case you can't go outside, if you need to make a phone call, I know you all are mothers, so I understand the importance of checking your phone regularly. Service in here can get very low. So you might only have about 2 bars on your phone, but once you exit, you'll have full service. So if you need to leave, feel free to exit out the back this way, go out the double doors, you'll see staff. In the case that you get thirsty, there's a cafeteria out here. You can grab some water, coffee. So I encourage you to go ahead and get up and leave. Restrooms, you should have seen all of them, but just in case, you need to go out these side doors, go up the first set of stairs, and you'll see restrooms available. And so I think that's it logistically. We have a great lineup of speakers. You're going to hear from the director of our Domestic Policy Council. You're going to hear from the First Lady's Chief of Staff. And you're also going to hear from some of our agency representatives. We're going to hear from a lot of African-American women who are senior leadership here in the Obama administration. So I just wanted to make sure that you all get the experience today of seeing the vast amount of women that we have here in the Obama administration, but then also hearing from our top leadership on important issues. So I hope you came ready with questions, ready to really make sure that you understand the policies, and to make sure that you say that you're here on Twitter. So I believe that handle is at Mochas. Mochas at WH. And we always ask people to also put pound at the White House. So you can say, I was here for an office public engagement event, pound at the White House. So you can start tweeting that, put it on your Facebook page. I saw all of you taking lovely pictures up here. So make sure that you go ahead and add that to your Facebook and your Twitter now. Just to tell you a little bit about myself, I worked in the administration for the past 3 years. My background is in education and policy. I am from Atlanta, Georgia, and I think I saw, Georgia girls, and I am a proud member of Delta Sigma Theta Sorority Incorporated. Saw the sorors taking the pictures. Love y'all. I'm sure some other organizations are represented here as well. Yeah. But no, I welcome all Greek organizations, and it's great to see the variety of women. Do we have any women from Chicago? Yeah. Yay! I moved here from Chicago. I lived in Chicago for about 10 years, so lots of love for Chicago as all. Always. And I thought I saw someone on the list yesterday from Duluth, Georgia, because I went to Duluth High School. All right, did Duluth. Any women from California? West Coast. We're heading out to LA. Any Texas? New York? Always the East Coast in the house. Wow. Did I miss any? Northwest? Washington? Oregon? Oh, the South, the rest of the South. Lots of love for the South. North Carolina, Florida, Ohio, yes. Arizona, I was about to say Southwest. All right. And of course, the DMV. Okay. So we're all represented. Did I miss any areas, any cities anybody else wants to shout out? Michigan, yes. Okay. All right, so let's go ahead and get started on our policy briefing. We have, what we're going to have is we'll have two panelists, and they're going to give brief remarks. I will moderate, and then we'll have some question and answer time, and then we'll hear from some of our senior leadership in terms of speakers. So today, we have our first panel, and Dr. Nadine Gracia from the Department of Health and Human Services is going to take the stage for us. Nadine is our Assistant Secretary for Minority Health at the Department of Health and Human Services. And then we also have Jocelyn Fry. Jocelyn is a Deputy Assistant to the President and Director of Policy and Special Projects for the First Lady. So this is her right-hand woman in terms of policy. These two women are amazing, and I'm going to allow them to introduce themselves and then give some brief remarks about the work that they've been doing, and then we'll take your questions. Make sure you stand, go ahead and say your city again or your chapter that you belong to, and we'll take your question. So.
Good morning. It's wonderful to see all of you here. This is very exciting. We should do this every day. As Heather said, I'm Jocelyn Fry. I work for the First Lady. I'm her policy director. And I thought I would talk a little bit about her work on Let's Move, the childhood obesity initiative that she's been spearheading almost since we started. And I've been here since day 2, so I feel like a veteran. And why don't I give you just a quick overview of what we've been doing, maybe talk a little bit about how folks can get involved, and then after Nadine speaks, if you all have more questions, I'm happy to answer them. As many people know, is probably I'm sure all of you know, one of the major initiatives that the First Lady has been focused on is an initiative around ending childhood obesity. And she has often said that this is an issue that she selected largely out of her experience as a mom. And so it's a experience that I'm sure resonates with many of you, of really trying to figure out how to make sure that our home family was eating right, juggling a busy family life at home between her and the president long before they were the First Lady and the president, and really trying to figure out how to make it all work. And what she discovered, not surprisingly, is that the struggle she was facing was one that was not unique to her, and it is one that cuts across really all races, all economic levels, all parts of the country, and it is a huge issue that affects children across the country. And I think what struck her the most is the potential long-term impact of it, that it's one thing to just make sure your kids are eating healthy, but when you realize some of the data that suggests that, this generation of kids is more likely to have diabetes and some other very serious health conditions, and there's some questions about their lifespan in comparison to prior generations, it really sort of brings home the enormity of the problem. And the First Lady wanted to tackle this issue like she tackles most issues, which is not sort of come at it with sort of a knee-jerk solution, but really try to think critically about what would make sense. And out of that work came a very comprehensive report done by the Domestic Policy Council here that laid out essentially a roadmap for tackling childhood obesity, and that became sort of the underpinnings, the policy underpinnings of what was launched in February 2010 as Let's Move. It is a national campaign to end childhood obesity in a generation. And rather than pick an arbitrary year for ending childhood obesity, we decided to take sort of a long-term approach because it took us a while to get here. It took us, when you look back at the data, it's taken us a couple of decades to really get to the point where today, a third of kids are overweight or obese. And when you look at communities of color, particularly African American and Hispanic populations, it's closer to half of the kids are in that category. So it took us a while to get here, and our view was it was going to take us a while to really eradicate the problem. The campaign itself, the initiative, has a number of components. I could spend hours talking about it, and I'm sure you that would not be interesting. But it has sort of four prongs to it: one that focuses on schools and healthy eating in schools, one that focuses on really increasing physical activity. She often talks about the fact that this generation of kids is far more sedentary than maybe what we remember, and having to, we all had to go outside and play, and even if we didn't feel like it, we got sent outside anyway, and came in when the lights got turned off and that type of thing, whereas kids now, the data suggests that they're sitting in front of some sort of object for at least 7 hours a day. So the physical activity is clearly an issue. Food access, again, an issue that I'm sure resonates with many of the folks in this room. It's hard to tell people to eat healthy if they don't have grocery stores in their neighborhoods, if the food is not affordable, that type of thing. So that's been a core component. And also the issue of just making sure people have the right information to make healthy choices. The First Ladies often talk about going to the grocery store, looking at those labels, and they're incomprehensible. So if you can't figure out what the healthy choice is, then you're probably not going to make the right choice. And fortunately for us, we've gotten a lot of really terrific response from every possible sector, from communities on the ground, from faith organizations, from individuals to large companies, and we've been pleased with the success. We've worked closely with folks like Nadine and HHS and many of the agencies, and it is very much an administration-wide initiative. We just came off of a very rewarding but a little tiring 3-day tour to really celebrate the second anniversary of Let's Move, and the focus of that 3-day tour, we went to Iowa, Arkansas, we went to Texas, we went to Florida and Homestead and Orlando, and the idea behind the tour was really to highlight not simply successes, but really to talk about how Let's Move is operating at both the very sort of statewide level, the biggest levels, and also individual levels. So we went from Iowa, where they have a statewide initiative to become the healthiest state in the country, and they have a whole host of folks. We had 14,000 kids in a stadium, to the First Lady going and having dinner with a family who have been making changes in their own home, working with My Plate, which is the icon that was launched by the Department of Agriculture over the summer. And we're going to continue to do that. And there are lots of ways to get involved, from doing things in your own communities. There are Let's Move Cities and Towns, which HHS oversees. And working in your local community around, whether it's with your churches or with Girl Scouts or whatever you want to do to really try to make basic changes in your community. And I'm happy to talk about that in more detail. I think I'm going to stop there for a moment and let Nadine speak, and then I'm happy to answer any questions that you might have. So that's just a snapshot of what we've been doing, but I invite all of you to join us in the effort, because I think you all know better than anyone sort of the urgency and need to really address the problem. So I look forward to talking to you more about it.
Good morning. It is really a pleasure for me to be here this morning and to join Jocelyn on this panel. Again, my name is Nadine Gracia, and I am the Acting Deputy Assistant Secretary for Minority Health and the Acting Director of the Office of Minority Health at the Department of Health and Human Services, or HHS for short. I am a pediatrician by training, and so the health of mothers, the well-being of mothers, and certainly children is really important to me. And thinking in particular about minority health issues has been a passion of mine, and certainly the whole reason for being of my office, which really has as its mission to develop programs and policies that will help us eliminate health disparities or the health gaps that we see in minority communities. And it's truly just such an exciting time and an important time for us to be working on this issue, because this is certainly an administration, and as Jocelyn has talked about, an administration that really understands the importance of health. And in understanding that importance of health has really focused on prevention. And that's so important when we talk about the health of minority populations. The reason being is because the statistics really are troublesome, and I'm sure many of you know them, and I actually want to commend your organization actually for the community service work that you do in addressing health and health disparities. Certainly we see that there are higher rates of diabetes, obesity, cancer in minority populations. We look at HIV. African American women have high rates of HIV infection. Infant mortality, African American women have twice the rate of infant mortality, where babies dying in their first year of life. These are really concerning statistics, but this is such a great time because this administration has put health really as a priority and at the forefront. And one of the key ways that it's done that is through the Affordable Care Act, the new health care law that President Obama signed in 2010, which basically is one of the best ways and strategies that we have really to improve the health of all the nation, but really for us to tackle the disparities that we see in minority and underserved communities. And I just want to highlight just a few ways that that is being accomplished. When I talked about some of those disparities that we see, diabetes, cancer, heart disease, many of those conditions are preventable. But some of the challenges with preventing those diseases is that to get the preventive screenings, we see that minorities often don't receive those preventive screenings, or that they go late to get the preventive care that they need to stay healthy. And once they actually get that care, often they don't receive the same quality of care. And what the Affordable Care Act is doing is really to help make prevention affordable and accessible. So many of those screenings that I've talked about, such as screening for diabetes, screening for obesity, tobacco cessation, screening for blood pressure, with the healthcare law, new health plans are required to cover those preventive screenings at no cost to you. That means no copay, no deductibles, so that we can make those services accessible to all people. We also want to ensure, with regards to infant mortality and healthy pregnancy, that mothers have access to the services that they need to have a healthy pregnancy. And so again, those types of screening for conditions that can harm the mother, that can harm the baby, are actually provided as well at no cost. There are also services that will be implemented this year with regards to breastfeeding support, including access to breastfeeding supplies, because we know that some of those barriers exist as far as getting access. Yes, indeed. Some of the barriers exist to getting access to the supplies, but also to encouraging mothers to be able to breastfeed, to be in supportive environments, not just in the hospital, but when you go home, those women that are in the workplace, et cetera, to ensure that they have the skills as well as the clinicians, so people like myself being able to actually counsel effectively mothers to encourage them to breastfeed. And our Surgeon General has really been a pioneer in this area. She issued a call to action to support breastfeeding last year. But the Affordable Care Act is doing other things where we're also investing in clinics that we want to have community health centers, more community health centers in underserved areas to really help patients and others get access to the care that they need. We're investing in the workforce, so trying to incentivize and encourage providers to actually practice in those communities that need it most. But we also have provisions that really help to protect women. You know, insurance companies actually used to be able to charge higher premiums for women, where I'll give you an example that a 22-year-old woman could be charged as much as 150% higher in her premium than the same age man just because of her gender. Or that insurance companies could actually deny women coverage because of pre-existing conditions such as cancer, or could you believe it, having a baby. And that no longer is the case, that insurance companies cannot do that. Absolutely. There are also provisions when we talk about children and youth and young adults where we know that there often is a high uninsurance rate for young adults, especially as they are crossing into adulthood. And so one of the provisions in the Affordable Care Act is that young adults can actually stay on their parents' insurance plan until the age of 26. And that's the case whether they can actually be married, they can be financially dependent on you, they can actually have started employment, but they actually can stay on your insurance until the age of 26. And as mothers, I'm sure that gives great peace of mind to know that as your children are making that transition, that they don't have to worry about their access to health care. These are just some of the provisions in the Affordable Care Act, and as you see, it's the reason why it's so important for us to continue to move ahead to really ensure that by this strategy, by this law, we are able to actually encourage prevention and really have a healthier nation for everyone in the U.S. There's also strategies that we have out of our department that under the leadership of Secretary Sebelius, who is certainly a dynamic woman and really taking charge and leading us in this department to address disparities. Last year, we actually released our first ever action plan to reduce racial and ethnic health disparities, the first one ever. And this is a plan that all of our agencies within HHS are committed to. So we have leadership from the top levels of the department who have said we will make disparities and the elimination of disparities a priority. We're addressing issues such as transforming healthcare. We're addressing workforce issues. We're looking at the research that we need to do to continue to better understand the disparities that we see and better target our interventions. But we're also looking at how we make decisions with our programs and policies to say, how will this program or policy help us to reduce disparities? And then we're also tackling certain disease issues like heart disease, influenza, flu. We're in the middle of flu season, tackling those types of disparities that we see to make sure that we can eliminate them and reduce them over time. And this is really a tremendous effort for the department because what we see now is that we have the levers through the Affordable Care Act, through our first ever action plan on disparities to really make this happen. But we also, in the Office of Minority Health, have something called the National Partnership for Action to End Health Disparities. And this Partnership for Action is a community-driven, community-organized approach that we work in partnership with communities who have actually identified what they can do to actually help us end health disparities. And so last year as well, the National Stakeholder Strategy for Achieving Health Equity was released, and we have regional councils across the country comprised of and led by community leaders who are working actively to address the disparities issues that they see in their regions. So you can see there's a lot of momentum that we have in the department, and we're working across the federal government really to address these issues. And I'll conclude with just one example of a program in our office, the Office of Minority Health, which is related to infant mortality awareness. This is a campaign that was started in 2007 called A Healthy Baby Begins With You. Again, as I mentioned, because we see that the rates of infant mortality for African American infants are twice that of whites. We see that a higher rate as well in American Indian and Alaska Native infants. And so this is a campaign where we're working to make sure that women understand the risks for infant mortality, as well as the higher rates of preterm birth or low birth weight infants. And we've expanded that program now to also include a preconception health program where we're actually teaching college students about the importance of preconception health and that they can become ambassadors to teach their peers so that we can basically have a pipeline of women who understand the importance of preconception health and really help us to eliminate and reduce this disparity. So I'm very excited to be here. I commend you for everything that you do, in particular being the mothers that you are, and I look forward to answering any questions that you have. Thank you.
So at this time, let's take a few questions. Let's start from this side of the room. Make sure you say your name and your chapter.
Good morning. My name is Christine Garrett, and I represent the Howard County chapter of Mocha Moms. I'm one of their co-presidents. And I'm a resident of Baltimore County, and I have a very interesting dynamic. I have two kids, 8 and 6. I am presiding over a chapter where the moms are very engaged in leaving and being organic and being very thoughtful about what they eat and how they move. You mentioned the Let's Move campaign. My children attend Baltimore County schools, and what's very interesting is that recess has been considered an option and not something mandatory. I grew up where lunch and recess were together, so we're talking 30 to maybe 45 minutes of lunch and just break time. What I would like to know is, how is the Let's Move campaign directly or indirectly encouraging or influencing policy on the state and local level to, for lack of a better word, enforce or encourage recess not being an option, but more so a mandate? Because I think a lot of us have discussed over, just in conversation, that PE classes are just being wiped out in certain areas, and I find it very unsettling that as a mom, that my children only get maybe 20 minutes to break from the day, and yet the teachers are wondering why the kids are bouncing off the walls after lunch. And I'm not going to discuss the food. I'm not going to go because I'm sure someone else will address that issue. But I would like to know what is our First Lady doing, and what the policy that we have set in Let's Move, how are they doing to address the physical activity of our children? Thank you.
That's a great question, and it hits the nail right on the head. There are a couple of things that we are doing to address it. The first thing, though, I'll preface it by saying is that we have some real limits in what we can do. We can't force schools to make those decisions, nor do we want to. We want schools and districts to have the discretion to make decisions that seem right for them. One of the things that we've done is, first of all, emphasizes one of our key priorities, really increasing the percentage of kids who participate in physical activity and get 60 minutes of play a day, which is a core principle of the Let's Move campaign. And one of the programs that we've lifted up that we emphasize a lot is a USDA program called the Healthier U.S. Schools Challenge. It's a program that if schools join it, and you can either be a bronze, a gold, or silver, or a gold with distinction, and if you join it, you essentially are making a commitment to do a certain set of things, meet a certain set of standards when it comes to the nutritional value of the food that you provide, to do nutrition education with all of your students, and also to provide for a certain amount of physical activity for your kids a day. So it is a program, if you join it, our view is that you are hitting all the components that we think are necessary to make sure that kids are getting both healthy food and sufficient amount of physical activity. And one of our goals in the report that the Domestic Policy Council issued was to increase the number of schools that participate in that program over time. Our first goal was to double that number. We met that goal last year. We were trying to get to 1,250 schools. We exceeded it. And then we have a goal of adding at least 1,000 schools a year that do that. When we went on our tour last week, we actually have already met the June 2012 goal. In fact, we've gone past it by a significant margin. So we're going to continue to really push schools in the way that we can to really encourage them to invest in physical activity and to make that a core component of what they do. The other thing I would say is that the First Lady often talks about one of the very first events that we did to highlight the schools that were participating in that program was out in Alexandria, and one of the principals said to her essentially what you said, which is that he found that their kids did better when they were not only giving them healthy food, but they were setting aside a sufficient amount of time for recess and physical activity, that they performed better academically. There's data to show that. And I think, the dynamic that we're facing is that there are schools that feel like they're under a lot of pressures. They sometimes, mistakenly think that recess is a way to meet some other goals. But what we've reinforced is that if you talk to the schools that are actually making this work, they will tell you their kids do better when they actually have a balanced approach to these issues. The last thing that I'll say about it is that we've also made a point of lifting up schools that are not just in sort of more elite communities where you might argue that they have greater resources to provide healthier food. One of the schools that the First Lady has visited is out in Southeast DC, River Terrace Elementary. That was one of the first silver or gold schools under the USDA program. Not any additional resources, but just a committed principal who believed in trying to make sure that her kids, it's almost I think 99.9% 9% African American population, but she understood that physical activity was a core component, and they've made that commitment. So we've tried to lift up schools across the country that have been doing what we think is necessary to ensure both physical activity and healthy food. The very last thing, though, I will say about school lunch, to anticipate a question out there, is that one of the biggest accomplishments for Let's Move is pushing the child nutrition law and making that become law. It was the most significant change in schools into school lunch in over 15 years, and will mandate that schools across the country reach higher nutrition standards to ensure that they are actually getting healthier school lunches. So that for us was an enormous accomplishment, and I think we'll do a lot to make sure that kids are getting healthy food. But thank you for the question.
Right here.
Good morning. My name is Letitia Elcock. I'm from the Alexandria chapter in Northern Virginia. I really loved what you had to say about A Healthy Baby Starts With You, and how there are preconception classes offered to college-level women who are considering becoming a mom. I'm concerned about that population that's not in college. There is a giant population of women in this country that graduate high school or not, and then move on and they begin to work. How does the administration plan to reach out to those women who may not be on a college campus, but still need this information to make sure they too can produce healthy babies and be effective moms?
It's a great point and a great question. And actually, with that campaign, we actually teach the college women, but the college women then interface and interact in the community. So it's actually it's not limited to the campus. Actually, it's that they go out and become ambassadors to the community. And so that can transcend those who are actually in college and those who are not in college. But we also have, actually it was just announced this month, an initiative called the Strong Start Initiative that HHS just released to actually help, as well as being a campaign where issuing $40 million in grants to healthcare providers, to community coalitions and others to also work on this issue with regards to preconception health, to try to reduce the number of preterm births that we see, low birth weight, as well as reducing the number of elected deliveries, C-section deliveries that we see before 39 weeks, because that can be a risk to the mother's health. And so we actually are investing in that way. So there are many different ways that we're doing that, but we certainly know that we want to target those who are most at risk and utilize different vehicles, so it doesn't just come from us as providers, but it can come from peer to peer. And I think that's a very effective strategy for us, because it comes from people who they trust and who they know in the community.
Oh, wow. One from the side of the room.
I was just thinking about I'm sorry, I'm Robin Page from Hampton, Virginia, Hampton Roads chapter. Was thinking about the Let's Move, and as far as exercise, even because we know our children are in front of a screen of some sort, is there any partnership with Wii or Xbox with like Just Dance or Zumba to create maybe a Let's Move exercise program?
A couple of things. One of the things is that we always emphasize you can get exercise in a lot of different ways. I mean, the First Lady talks about that it's not just, going outside. Even if you're at home and you don't have the ability to go outside, you can turn on the radio and dance or Wii or whatever the different opportunities are. The key is to get to move. So we definitely emphasize that. One of our priorities this year is to really focus on the physical activity piece, and we work very closely with an organization called the Partnership for a Healthier America. They are the entity that has been the facilitator for a lot of the big business agreements and corporate agreements that we've had. And so one of the strategies that they are looking at right now is whether or not there are some specific initiatives that we could do with partners like that, or there are other initiatives around, pedometers and things like that, things that acknowledge the technological age in which we live, and try to build into that additional activity as well. So those are things that we are exploring, and I'm sure, in the coming weeks that we'll be able to talk about them in more detail.
And if I can just add from the HHS perspective, we also have the Surgeon General who issued a vision for a healthy and fit nation and talked about many of those other ways in which kids can actually get physical activity. And when I was in practice, I would talk to the youth in my office, and they would say, well, we don't like gym, or we don't like to, be out, and we're not athletic enough to be in sports. And I will say, well, do you watch videos? Do you watch music videos? They say yes. I said, well, what do you do when you're watching? Well, I just sit on the couch. I said, then get up and start dancing to the music video. And so you have to be creative and give kids different options as far as how they can get that exercise, because we also recognize too that there are communities where it may not be safe for the kids to be outside and getting that type of physical activity. But we also have the President's Council on Fitness, Sports, and Nutrition that also works very closely with Jocelyn's office to really promote physical activity as well. And they have initiatives and campaigns of how youth and others, adults as well, can get physical activity on a regular basis without necessarily needing to have specific gym memberships or access in other places, but to make it accessible, affordable, and something that can be fun.
One from this side of the room. I'll make sure to get you.
Hi, my name is Bridget Obicoya, and I was born and raised in Mobile, Alabama, but I live here in Arlington, Virginia. And I am in the Southern DC, Washington, DC chapter. And I am an advocate for sensory processing disorders and design in the home, and in particular, ADHD, autism, Asperger's syndromes, and things like that. And what I'd like to know is, I know that there's a direct connection first between movement, nutrition, and neurological disorders. And I want to know if there's anything in particular that you all are doing that target children. And I know also that ADHD and other neurological disorders are on the rise most between boys, in particular African American boys. And I wanted to know if there's anything you're doing in particular to target that segment of the population and as a whole. Thank you. Oh, and also I have to say that I'm a blogger, and I blog on these issues, and my blog is B is for Bloom.
Well, certainly, the issue of autism and other spectrum disorders on that spectrum, if you will, it's been a challenging issue, and one that really is an important public health issue that we've seen. We have, and actually under President Obama, had significant increases in our investments in the research and the work that we're doing in autism, not only in research, but also in the services that we provide, because we recognize that it's not only about understanding what causes it, but also ensuring that those children who have autism or on that spectrum actually have the ability to really be fully productive members of their society, whether that's in school, whether that's in their communities or in their families. And so we have actually a committee, it's called the Interagency Autism Coordinating Committee, that we run at the Department of Health and Human Services, that is looking at many of the things that you have raised, looking at the research issues and asking what types of questions do we still have yet unanswered to better understand why is autism on the rise, and how do we target our programs to better address that. But also, what are the services that these youth need, whether it's educational, whether it's in health services, employment, et cetera. And then also understanding that there are differences that we're seeing, whether it's in the males versus females, whether it's minorities or non-minorities. So we have those initiatives that are underway to really try to address those problems, because we see that it's complex, it's multifactorial, and we're not clear on exactly what the cause is and why it's increasing, but we know that if we really continue these more comprehensive efforts, that we can basically help support the youth who have it.
Good. You have a question?
Yeah, this actually follows up a little bit, so thank you for bringing that up. My name is Tawana Smith. I'm from Brooklyn. I live in Maryland now. I have to represent Brooklyn. Anyway, former state coordinator for Maryland, and I'm not going to get choked up, but I'm a mother of a 4-year-old with autism, and my husband, he was a reservist, and he was an employee of Department of Homeland Security. So this past year, we had to make a decision for him because of insurance, and this is really an insurance question. We had to make the decision for him to leave Homeland Security to go and be active duty because TRICARE paid for more of our stuff than our federal insurance did, unfortunately. And,
obviously if we go active duty, that's going to be a cut in what we're going to, take home for take-home pay. But that's a sacrifice that we've had to make because, for instance, ABA therapy, 1 hour of ABA therapy is $100. 1 hour, we do speech therapy at Kennedy Krieger Institute, which I'm sure you're familiar with in Baltimore, which is one of the premier places for, in the area for children with autism, and autism-related disorders to go to. One class costs $425. Insurance pays for 1 month. This is Maryland now. Maryland mandate is very different from other states, but there's so much unclarity with insurance companies and so much disparity across states that you have families making a decision, should we stay in this state? Should we move to some place like Florida? Should we move to Pennsylvania? Should we move to New Jersey that are mandated to provide a certain amount of services, or just to provide services in general, OT, ST? And I mean, I really want to know what provisions are being made in the Affordable Health Care Act for autism, because as you know, it's on the rise. And one of the things that I fight with I try to help Kennedy Krieger with is there are so many of our children who they don't have access. Their parents just don't know. They just don't know. And they did a research study trying to say that it was based off of access being based off of race. And I said it's not necessarily race, it's more socioeconomics, because a white family that does not, who is in the same socioeconomic class as a black family is going to have the same amount of limited access. So really we want to know, and it kind of leads off of her question, how is it being mandated, what provisions are being made in the Affordable Health Care Act to allow more people to have access to these services, because quite frankly, they cannot afford it. And so, my thing is, if you don't pay for them now, you're going to pay for them later. Right. So, I mean, I'm really trying to stay at home. I mean, my options are, because you have to go to therapy all day, almost every day. My option is to stay at home, but I'm really feeling like maybe I should use my public policy degree and go back and fight and, be a lobbyist or something to really I personally think that there might not be as many parents of kids with autism on these boards, and therefore the policy is not being written correctly. Right.
So you raised certainly an important point, and one that we have seen, that the services that are provided across states actually can differ. And actually one of our agencies, the Centers for Medicare and Medicaid Services, was looking at that very question to compare what states offer so that they can actually see what is the disparity that we're seeing, because we would hear these stories of parents who may move to other states to be able to get different types of services. One of the key provisions of the Affordable Care Act is related to what we call the pre-existing condition, what is referred to as the pre-existing condition. And one of the provisions in the Act is that children under the age of 19 cannot be denied insurance coverage because of a pre-existing condition. Asthma, heart defects, they cannot be denied health insurance coverage. This is an important step because insurance companies were able to deny that coverage or be able to rescind that coverage. And so that's one of our first key levers. And I think with regards to the services that are actually provided, this is where we have many of our agencies that are looking at what are the services that will be most effective to really help optimize those children's lives so that we can provide the evidence to show that these are the types of services that should also be covered in the coverage and the health care that they receive.
Okay, well, thank you. That's going to wrap our session now for this panel. So let's just give a special round of applause. Thank you, Jocelyn and Nadine, so much. So now we have the opportunity to hear from one of the recent appointments here that the President made to the Domestic Policy Council. It was actually just a shift internally, as we worked previously as the Director of Intergovernmental Affairs. Cecilia Munoz is now the new Director of the Domestic Policy Council.
Thank you. Good morning, everybody. It's so wonderful to see all of you here. I'm so excited. I think this is a really awesome organization. So I'm very excited to be here with you and honored to be here with you and grateful that you've come from all over to be part of this session today. I know we're going to try to make it as useful a day as possible, as useful to you, but also hopefully, the better we're connected, the better job that we can do in the work that we're doing day in and day out for people around this country. So really, thank you for your energy and your commitment and your time. It means the world to us. It sort of feels like we got people who have our backs a little bit. That's kind of nice. Just to introduce myself a little bit more, as you heard, I was the Director of Intergovernmental Affairs here at the White House for 3 years, and just about a month ago, the President asked me to succeed the amazing Melody Barnes as the Director of the Domestic Policy Council. They are not easy shoes to fill, to say the least. But I inherited a really, really wonderful team that's working on a range of policy issues. And before I started with the administration, I worked at a civil rights organization for 20 years called the National Council of La Raza. It's the nation's largest Latino civil rights group. Oh, thank you. Thank you. That means a lot to me. I grew up there. I worked there for 20 years on a whole range of public policy issues. So while the issue that I am best known for, the issue that I have the deepest expertise is immigration policy, I've spent my whole career working on education, on healthcare, on issues of poverty and economic opportunity, on housing, on a whole range of other issues that we work on here too. And I learned from deep experience that we had a lot to do in this country to really achieve our promise and our potential and our commitment to our best values as a society. And that we are most likely to achieve that dream if we're working collaboratively, if we're working together, if we are really lifting people up and making sure that, frankly, that we hold policymakers' feet to the fire. And that's part of what you do. It's a big part of what you do, and it is essential to our ability to be successful as an administration. So for me, it's a huge honor to be doing this work here in this capacity at the White House. We have teams in DPC and the Domestic Policy Council engaged very deeply in the weeds on a whole range of issues, and a lot of them are reflected in the budget that we released this week. That was only just this week. We sort of, each day is kind of like dog years here, so it seems like it was longer ago than just actually 3 days, but we introduced the budget on Monday. And I want to raise the budget because it's important. It's a blueprint for what the president has said he's trying to achieve. If you heard him give his speech in Ottawa, Kansas, he talked about our values as a society, that we ought to continue to strive to be the kind of place where if you work hard and you play by the rules, you ought to be able to be confident that you can raise a family and count on a good education for your kids and count on access to health care and be able to own a home and put a little bit away for your retirement. That everybody needs to be playing by the same set of rules. And that's the kind of country that we need to be, and that's the kind of those are the kind of values that we need to continue to work towards. And he laid out that vision in his speech in Kansas, and then he built on it in his State of the Union address with more specifics about, so what does it mean if we're going to be that kind of society? What does that mean in policy terms? How do we make that real for people? How do we make sure that those values are working in people's lives all around the country? So the speech is the next opportunity to sort of provide detail, and he talked about the kinds of investments we're making in energy and in manufacturing and in our students and in our workers, and in sort of reinvigorating our values in this country. And then the next level of detail, and it's a lot of detail, is in the president's budget. And so the budget, I'm not going to recommend necessarily that you go through all of the documents, although they're available on the White House's website. But what really matters is this. This is a document which lays out the president's blueprint. It's the roadmap for how we want to achieve that vision, those values, and make them real in people's lives. So it talks about starting with preparing our students and our workers to make sure that they're ready to meet the challenges of this growing economy. This is a budget which presents a balanced picture, right? It reduces the deficit to the tune of $4 trillion, but it also makes really critical investments in the things we must be investing in if we're going to continue to grow the economy, if we're going to continue to create jobs, and if we're going to continue to make sure that everybody has access to those jobs and that everybody is prepared for those jobs. We know that there are sectors of the economy, these are businesses telling us, we're going to need millions of workers in the technology field. We're going to need millions of workers in healthcare. We know where the needs already are. We know where their business is telling us, we have jobs available now and we can't find the folks to do them because they don't have the right training. So that's about making sure we're investing in our educational system, and this is an area where we have been deeply, energetically involved since day one. It also means investing in programs for workers, for people who are in the workforce, who need that training, who need those skills, people who are going into community college, making sure that they're getting the training that they need for jobs that we know are actually available in their communities, that it's not a theoretical education, that it's education towards good jobs, well-paying jobs, jobs that can provide benefits and some security for people in their communities, working with employers who say, look, this is where we know we're going to need workers. Let's build a curriculum so that you're, as a community college, really are doing the career training for the kinds of jobs that we're going to need. The president announced a Community Colleges to Careers program, an $8 billion investment just this week, which is a big piece of the federal budget. We're also investing very, very seriously in education at the K-12 level and in higher ed. So you've probably heard us talking about the Race to the Top program. There's another $850 million going into the Race to the Top program. And the way that program works is that it essentially has spurred the kinds of reforms in more than 40 states. Now, not all of those states got grants, but we used the program to make sure that those states were moving forward in reforms, the most important of which is about making sure that we have the right accountability mechanisms in place to make sure every kid is moving forward in our schools and that our schools are designed to achieve educational success for every student. And we know that the old system, under the No Child Left Behind law, was deeply flawed. And we have been investing We have invested very heavily in reforms to that law, and frankly, like a lot of other things that the president is working on, like the American Jobs Act, the reforms to the No Child Left Behind law, are stuck in the Congress. We don't have the bipartisan partners we need to get the big reforms through. So what we're doing is using the tools that we have to make sure that reforms happen anyway. Race to the Top is a very big piece of that. And the president announced in his budget that we want to expand Race to the Top to the higher education sector, to use those resources to get states and colleges and universities to make sure that we are making college more affordable. This is an area where we've made lots of gains in the last 3 years. Pell Grants are bigger and they're more available. We've changed the way that the college loan structure works so that folks only have to pay back a proportion of their incomes so that they can manage their debt successfully while they're working. That stuff is done already. We've accomplished that already, but we know we need to do more. So these kinds of reforms that are reflected in the president's budget are making sure that we keep college affordable, making sure that we have the right accountability mechanisms in place in the states to make sure we're making progress for our students. And we're investing to the tune of $5 billion in reforms for teachers in this country, in making sure that this is an honored profession, it is a well-remunerated profession. Right? We need to make sure that we're providing the best possible training and education for people going into the teaching field. We need to make sure that we're not using just a test as the one way of measuring whether or not these folks are effective. So we're talking about things like game tapes, right? Like peer reviews, making sure that teachers are getting support from each other, and that we have the best trained, the best paid core of teachers and principals in our schools, because we know that that's how you move the needle for our kids. So a lot of this stuff we would be able to do on a bigger scale if we had legislation, and we're going to keep pressing for that. But this president is pressing forward with what he can do, and I have the privilege of working with a highly energized Secretary of Education who has the great virtue of not only being very skilled and very committed, he's really impatient. And right? But he's impatient for all the things he should be impatient for. And to work with someone who's putting that level of energy into making sure that every student in this country succeeds is a great honor for me, because it is among the most important things we can do to make sure that our country is moving forward, that our economy is moving forward, that we are on the best possible footing for the work that we need to do in this 21st century and in this global economy. So that's just a couple of areas where we've made investments. There's a lot more to talk about. But what I want to most say to you is this, because I so deeply respect the commitment that led you to be connected to this organization, that led you to take the time and energy to come here. Like many of my colleagues, really like all of my colleagues, everybody has a story to tell, and I hope Tina Chen's sitting right there. She's going to speak to you next. I hope you ask her for her story as well. I have the great joy of working with people and for, people who are deeply, deeply committed to making sure that when we talk about economic recovery, that we are talking about every corner of this country. When we talk about supporting people who are looking for work, that we are supporting everybody who's looking for work, including people who have struggled with getting in the workforce for a long time. That when we talk about building the economy, that we are talking about making sure we prepare every student and every worker to fulfill to their highest potential. And the notion that nobody in this building needs to explain why it's important to make sure that we are reaching every corner of this country and every community and every constituency. Nobody needs to explain that. I mean, I've spent a career explaining that to people working in the civil rights community and talking to policymakers about how sometimes you have to go the extra mile for certain constituencies because it's not a given that if you set up a job training program that they're going to be served by it, right? We've all done that work. We've all had that conversation. I haven't had to explain that to anybody that I work with. Why? Because my colleagues are all people who've been doing that work all of their careers. This is a very deep commitment. And so we have a president who is moving these values forward, who's fighting with the Congress, frankly, which is not always the most cooperative body in the federal government, who's doing what he can with the administrative tools that he's got. Those administrative tools are insufficient to do the job, but we're doing what we can while we work on the big picture and fight those battles. But the most important thing is that for all of his gifts and his oratorical skills and his capacity and for all of the talented people that he has working with him in the federal agencies, this president can't do it by himself. We can't do it by ourselves. We really need you. We need every pair of hands, every voice. We need to know what you know and see what you see in your communities all around the country. We need to make sure that that's informing the work that we do. And we need to make sure we're giving you the tools that you need to do your job well to help be a voice for these values that we're trying to move forward. I don't know if we have time. I know Tina's here and she's the next speaker. I don't know if we have time for questions, but I just especially want to thank you for the work that you do. Do we have a couple minutes? She's let me take 2. Yes.
So much for being here. I'm Donna Maria Coles-Johnson, and I'm from Washington, D.C., but I'm representing the Charlotte chapter today from North Carolina. And you've spoken in great detail about domestic policy, where jobs and education and things are concerned. And I'm a small business advocate. And one of the things that I'm noticing, and I'm sure you are as well, is that our country and the world really is moving more towards small business being redefined, really not as small businesses as they're currently defined, but really as individual people owning their own businesses and working from home. And I don't see this any more prominent than I do with women. And I'm the Work at Home Network Director for Mocha Moms. And so I would like to ask you, I see the president doing a lot of things. He has signed an executive order, sharing that, we need to make sure that small businesses are taken care of. The leader of the Small Business Administration has just been elevated to a cabinet level.
She is awesome, by the way.
Yes, she is.
We know that that's where we're creating jobs, and that's why built into this budget are things like tax incentives for small businesses. Built into this Community Colleges to Careers program that I just announced, that's $8 billion, is a specific program for entrepreneurs. So it includes online training programs for folks who can't necessarily get to a facility that's providing training, as well as broader, hands-on, in-depth training for people who are seeking to enter this sector. And Karen Mills, who is our administrator of the Small Business Administration, is both very passionate and very eloquent about making sure that we're giving people the tools that they need so that they can enter this sector and be successful in this sector. And we know that the first 2 years for a small business owner are critical. That's the critical point. And she has geared the resources of her organization, of the Small Business Administration, but we're also gearing the resources of the Department of Labor and the Department of Commerce and other sectors to make sure that we are providing the right incentives through our tax structure, the right supports through experts around the country to make sure that people know, for example, how to get into the export sector if you're a small business that's producing a product, to make sure that we are helping you gain access to markets overseas. This is an area of great energy for this administration. Why? Because we know that that's how we create jobs. So thank you for the question and thank you for the work in this area. It's great. One more. Yes, ma'am.
Hello, I'm Delnae Gray from the Northern Prince George's County chapter, originally from Los Angeles. And I used to work with Melody Barnes in the Senate, so I'm really good friends with her. But I wanted to ask you a question about business and the mortgage crisis and what's going on there. I'm also a stay-at-home mom, but I also have a real estate investment company. So obviously, my industry has been hit hard by the mortgage crisis. And I know the president talked about the plans he has in terms of implementing the mortgage controversy and what he's going to ask the mortgage companies to do to revamp the mortgages to help with people who are underwater with their mortgages. What is he doing in that regard? And also, because of course, as an investor, the money has dried up in that area as well.
Right.
So is there something that he's doing for investors like myself, and of course, all of the women who are sitting here that are homeowners that would love to see their mortgages and these are people who usually aren't late, like, you know.
Right. This is another great question. Thank you. So this is another area of huge need and huge concern. And this is an area you've been hearing about the president making these "we can't wait" announcements, right? While we try to work with Congress to get the big stuff done, the big reforms done, we've been scouring to see what administrative tools that we have in order to make change for people in the meantime. And he made a "we can't wait" announcement. This is a couple months ago now, exactly with respect to homeowners who are underwater with their mortgages, who have not been able to access the historically low interest rates that are available to other borrowers right now. So this is an effort to, and this could help more than 1 million homeowners who are underwater with their mortgages, who need to refinance, and to make sure that we make available to them the capacity to refinance at those rates, right? That saves, as you know, that is hundreds of dollars a month, sometimes more, to an individual homeowner. That can make or break whether or not they're able to stay in their homes, whether or not they're able to make it, whether or not they're able to reinvest those resources in their small business. So this is something that the administration is doing on our own. We can do it on a much larger scale with a little help from the Congress of the United States, but this is an area where we're moving forward and doing as much as we can for people because we know how critical it is. It's certainly critical for the economy, but it's critical for these families. And really the focus for all of these efforts, for the payroll tax deal that we think is going to, I'm knocking on wood, is getting finalized today. That includes an extension of the payroll tax and unemployment insurance. This is about folks who are working hard and trying to make ends meet, trying to do their part and trying to keep house and home together. That's been a real focus. That's going to continue to be the president's focus this year. And again, we can't do it without you. So thank you for everything you're doing. And I will turn it back over. Thanks.
So at this time, now we have the Chief of Staff to the First Lady and the former Director of the Office of Public Engagement, Tina Chen.
Thanks, Heather, and welcome to the White House. Good morning. It's wonderful to see all of you here. I know you've traveled here, and it is great to hear about Mocha Moms being out there and connecting with all of your members. I will say there was, we talked about your being here at the senior staff meeting this morning, and people were pretty excited to hear about Mocha Moms and hear about you being here. So welcome. I want to echo where Cecilia left off, which is reason we're so excited that you're here is that we cannot do this all alone. And one of the big things we've been learning over the course of the last year and a half or so is how little people really understand about what the president has done. There's this narrative that's out there that nothing has happened, and Obamacare doesn't help anybody, and we're not doing anything to help the economy, and yet we've done a tremendous amount. And once people learn about that, then they understand, and then they're supportive. And so you are so important on getting that message out, and I really thank you for taking the time. It's a big chunk of really busy lives for all of you to take the time to be here to learn that detail, and we're really grateful for that. And then we are really grateful for then what you're going to do on turning around and then getting that message out. The other thing that we've learned through some of the research that folks have done is actually people don't get a lot of information anymore from the newspapers or from the television network news. They get their information from each other. People are getting their information from you, from the articles you send them, not the articles they're picking up on their own, or the blog posts that you are putting up. So your role as messengers here is so important. So I'm going to do a couple things here because, like many people in the White House, none of us does one thing. We all have to do multiple things. So in addition to being Chief of Staff to the First Lady, which I've been for the last year, I am also the executive director of the White House Council on Women and Girls. So I'm going to talk about both of those things. So first, for the First Lady, it just is it's such a treat and a delight for me every day, I have to say, to come in to work in the White House, but not just that, to sort of go over to the East Wing and to work with our First Lady, who is just such a remarkable person and a remarkable leader. Our Policy Director, Jocelyn Fry, is going to be here a little bit later this morning. She's going to tell you more in depth about Let's Move, her effort to end childhood obesity in a generation, so important to the health of our children and of ourselves, and she's really passionate in talking about that. I will say that we just came off of a 3-day 4-state, 5-city tour last Thursday, Friday, and Saturday. Hopefully you saw some of it along the way, promoting the 2nd anniversary of Let's Move. And, you know, our First Lady will do anything. She will do push-ups with Ellen. She will do dancing. She danced on the stage with 14,000 kids in Des Moines on Thursday doing something called the interlude dance. She then did the platypus dance on Saturday in Florida with Disney characters. So she will do anything to promote the health of our children. So that's so important. So I'll let Jocelyn fill you in more on that. Our second initiative, which I also hope you've heard about, is Joining Forces. And Joining Forces is the initiative we launched last April together with Dr. Biden to really support our military families and our veterans. Yeah, I mean, these are families, absolutely. You know, the statistics are after 10 years at war, you know, really 1% of our country is part of our all-volunteer force, and they have really served and protected and made the ultimate sacrifices for the rest of us. And I'm in that rest of us, the 99% of us who are not from a military family. And, you know, it really is our obligation, the rest of us, that's a different 99%, that's 99%, to support our veterans and our military families. And so often our military families don't wear the uniform. You know, but they are still enduring 9, 10, 11 deployments of their military family member. You know, we've got kids who sometimes move 10 times before they graduate high school. And we were at an event yesterday at the Pentagon with the First Lady and Dr. Biden and Secretary Panetta and all of the Joint Chiefs. Everybody was there to underscore the importance, talking about spousal licensing. And this is actually something I'm going to charge you all to do when you get back home, because it's something everybody can do in every state. What this is there are about a third of military spouses we now know are in some sort of licensed occupation. They're a teacher, they're a nurse, they're a dental hygienist, a real estate broker. Somebody just mentioned they were a real estate broker, a lawyer. Those are professions that are licensed state by state. And when these military spouses have to move with their military service member multiple times, we had a nurse yesterday who introduced the First Lady who told the story about how at one time when she moved, she just gave up because it took so much paperwork to get her nursing relicensure when she moved from one state to another. And so, you know, they're losing that money in their bank account, the economy is losing out, their kids are losing out. That's something every state can do. We can't do it federally, it's state regulation, but we're calling upon every state. About 11 of them have already done it. We're calling on all the other 38 to 39 to enact state laws. So in your home state, you know, laws that will make it easier for military spouses to either get a temporary license or have reciprocity. There's lots of different models. It can be modeled to fit your state. And if you go to joiningforces.gov, you'll learn about joining forces. You'll learn about other ways. We want everybody to do what they can, whether it's, you know, go over to a military spouse member's house and offer to babysit her kids, or take care of the military spouse kids who are in your school or in your parish. You know, if you're an accountant, help them do their taxes. You know, as simple as sending somebody over to mow their lawn. Anything that you can do to help our military families, you know, we're asking everybody to do what you can to do that. And it's had tremendous support. I mean, really, it's just been so great. And the military family members are so grateful, and they are really feeling it, which is something that's very important to the First Lady. And then I want to spend some time talking about with my second hat, so the Council on Women and Girls. And we formed the Council on Women and Girls in March of 2009 by executive order. It's one of the first executive orders the president issued, creating a council that's really all of the federal agencies across the federal government and every major White House office. And when he created it, he did that instead of creating just one office for women's policy in the White House. We did it with this council to go across the entire federal government, because the president said then his charge to the cabinet was, every part of the federal government affects women and girls, some part, whether it's their own employees or in what they do in their policies and programs. And so every agency, as part of what they do every day, has to be to think about how are they affecting the lives of women and girls. And Valerie Jarrett is the chair. I'm the executive director. Valerie's traveling with the president, otherwise she'd be here today, and she conveys her welcome to you. I think it's important that Valerie's there because, as you all know, she is one of his closest advisors, longest friends. The fact that he gave her this job means that the voice of women and girls is in the Oval Office every day with him. It's great. It has just been great. So I have to say our federal agencies have stepped up across the board. So you talk about small business. I know there was a question about small business earlier. We, after 10 years of languishing, our administration issued finally the women-owned small business rule that gives women-owned businesses an equal footing to get federal contracts. They're discriminated against in 80 different fields. We've now issued a federal rule. It took effect in the spring of last year to now give those women-owned businesses a leg up. We've expanded the number of women business development centers that the SBA owns, so now we have 113 of them around the country to provide, I know the question over here, to provide that kind of grassroots, on-the-ground support for women-owned businesses. Valerie, 2 weeks ago, we were just at an urban economic forum in New York where we had 500 women entrepreneurs from New York, not only just coming to hear about what the administration was doing, but to connect with each other, and we did a mentoring session for them, and so that they could meet people who are venture capitalists and funders and investors. So we're going to keep doing that around the country, so that's what we're doing for women-owned businesses. Our Department of Transportation I love to talk about sometime because, who thinks about transportation and women as issues, right? But Secretary LaHood has been terrific. One of the first things he did the first year was to enter into a memorandum with Spelman College. Yeah, there you go. With Spelman to create opportunities for young women at Spelman to become engineers because we know that women aren't well represented in the STEM fields, science, technology, engineering, and math. And so they do not only their academic work while they're at Spelman, but they come and then they do summer internships at places like the Highway Transportation Safety Administration. And then he expanded that in year 2 to 10 additional schools. I happened to be there at the event where we penned the memorandum to do that and met this fabulous Spelman rising sophomore. So this young lady, if you think about this, she's 19 years old, she's a rising sophomore. She just finished her stint at Highway Transportation Safety Board. She was so excited to be a highway engineer. This is what she wanted to be at age 19. She was great. So 10 more schools, we're doing that. The other favorite example for the Department of Transportation, we asked everybody to think, what do you do in every one of your programs that affects women and girls? And think about how to adjust that. And as they did that, they realized, remember transportation does the crash tests for cars, right, crashworthiness. They realized that in the entire 40-year history of that program, they had never used anatomically correct crash test dummies for women. And they started doing that a year ago for the first time. And you all know, the seatbelt kind of hits us a little differently. The crash experience is a little different than for men. And they're now doing it. They've now changed that. Our military, I think you probably saw the announcement last week where we're expanding the number of roles that our women in the military, can serve in. One of my other favorite ones is that for the first time in history, we now have women going on to be officers on submarines in our Navy. And this is important because submariners are to the Navy what fighter jet pilots are to the Air Force. It's the way to leadership. And because they like to take the cream of the crop out of the Naval Academy, the only way to keep taking the cream of the crop and putting them on submarines was to expand it to women, because the cream of the crop coming out of the Naval Academy are women. So it's been great. And then finally, I can't leave the podium without talking about health care, because obviously the Affordable Care Act and the passage of health care reform is so important for women, for women's health. Women, before the passage of the Affordable Care Act, women, and currently now, because it's not fully taken effect, women can pay up to 120% more in premiums than men simply because they're women. And it's called gender discrimination. It's going to be outlawed when the Affordable Care Act is fully implemented. Important things like making sure that if you get breast cancer, the practice that insurance companies have of rescission, of kicking you off now that you're sick, is barred. They can't kick you off because you've gotten sick. They can't refuse to insure you because you have a pre-existing condition. And we have that important announcement that you all have probably seen recently in the news of the expansion of women's prevention health. So for the first time, the Affordable Care Act now requires all insurance companies to cover prevention services at no additional deductible or copay. That started with kids. We implemented the kids rule last year. So for all your children, your well baby care and inoculations, the kinds of things you need to for your kids are covered. Without that, we expanded it this last year to take effect later on this summer to women's prevention health. We've never had a standard for women's prevention health. The mammograms and pap smears and gestational diabetes, and for the first time ever, screening for domestic violence victims so they can get help. Those are all required to be covered. And the thing that's gotten a little bit of press lately is contraception. We're including birth control as a required, for insurers to cover at no additional cost of health pay. I mean, as we know that, 98% of American women are going to use birth control at some part. It's not just, it avoids unintended pregnancies, but it's key to avoiding lots of other diseases like ovarian cancer. I was just with the American College of Obstetricians and Gynecologists. They feel so strongly about this as an integral part of women's health care. Women have to use birth control for 30 years. I mean, that's the span for many women. It can be as expensive as $600 a year over 30 years. This is a real cost, and we know, there's about, a third of women who need birth control who say they can't afford it even today. So this is what, we're working on. We had an announcement last week. We've tried to strike a balance that recognizes the religious beliefs of both churches who are accepted, and now, as the president announced last Friday, an accommodation for religious affiliated organizations like hospitals and social service organizations so that they don't have to use their own money to provide the coverage, but the insurers will, so that we have both women getting coverage that they need and religious employers being able to have the respect for their beliefs that they should have. And we think that strikes the right balance. But I do think that there is a rhetoric out there that doesn't recognize that balance and tries to distort what's going on. So I hope you learn about what's going on there and, again, message that out to your members. And so finally, I think that again, just to echo my closing remarks, what Cecilia said is the theme is get that word out. Take what you will hear all day to day. If you've got questions, our Office of Public Engagement, Heather and her team are great at, just get to them with questions that we have. If you need more information, go to whitehouse.gov and get that information and then retweet it out to everybody. And thank you so much for being here, for everything that you are doing every day. Up to you. Question? Yeah, I think we got 2 questions. Time for 2 questions. All right? Yeah, you're right.
Good morning. My name is Kimberly Thomas, and I am a member of the Queens Long Island chapter. I'm also a mommy blogger, valleystreammom.com. I do it all. I have so many questions to ask you, but I'll just ask one. I have a girls empowerment program back in my community, and I am such a big fan of Michelle Obama and her program, everything that she's doing, because I have 2 small children, so the Let's Move works for me, and the White House mentoring program, I sort of model some of it after my own program. For the sake of my girls who don't know how to navigate life and how to get to where they want to go, they're 12 and 13 years old. What was the path that you took to where you are today?
Hard. So, and I have a 15-year-old too, so I know how hard it is to navigate our girls through the current waters out there. We were laughing yesterday because we went to a luncheon with the premier, the vice president, who's visiting, and the woman who wrote the Tiger Mom book was there. So those of us who are Asian children, yeah, a couple of us, Chris Liu sat next to her. We were riding in the van, and we both said, we were all kind of raised by Tiger Moms. And I confess that I was too. I'm not a Tiger Mom, though. I think I don't have as much energy to put into it. I try to do the no TV during the week like the First Lady does, and my daughter calls me every day at 5:30 and says, all right, homework's done. Now can I watch TV? For me, it was a lot of that. I came from a family with 2 girls, so I think that even though my dad is a Chinese dad, sort of really was hoping for a son, but he put all of that into his girls, which I think is what helped. Because I carried with him that those hopes and dreams and aspirations he might have all put into a boy. He put into me and my sister, and that really lifted us up and pushed us forward to succeed and gave us the self-confidence, I think, to go through things. And I think that's what our girls need. I was a lawyer before coming here. I was a lawyer at Skadden Arps in Chicago for 23 years. My path to the White House, I can't really tell anybody. As I often say, I can't really tell you how to meet a guy, with the big ears and the funny name 20 years ago, and then having become president. Can't quite tell you how to do that to get to the White House. That was just a little bit of fate and faith and blessing happening there. But I do think the idea that our girls just need to have confidence. We need to give them that self-esteem and that confidence. And so they know, as minority women, it used to happen to me as a lawyer all the time. You walk into a room, I'm the person there to solve their problem. But my male partner's taking me in there because he's the one who knows them, and I'm coming in because I got a special problem. I was a trial lawyer. But the first half of the conversation, it's all going to the guy, right? I mean, he's the guy they're looking to. And what we have to realize is to have the patience to know that eventually they're going to need the help. And so whenever they get through describing their problem over here, when they needed the answer, he doesn't have the answer. So, you're right? So they turn. They look to me, and then I got the answer. And then the whole rest of the conversation, they're talking to me. And you have to have the self-confidence and the patience to know that that's going to happen. To know that, you stick to your guns, you do your work, you are patient, and it will come to you. I mean, I often say that. If you do your work and you are good, it will come to you. You don't have to sort of be out there, kind of making a lot of noise and nobody's listening to me. It will come to you. So I think that's the message. And then one more. In the back there. Yep.
Hi, my name is Shania Coleman Kirkland, and I am the Georgia State Coordinator for Mocha Moms and the General Counsel for Mocha Moms, and I'm so excited to be here. I'm from Atlanta. I have a question that kind of piggybacks on the question that the at-home network director asked. Many of us in this room have kind of taken an alternative career path. My background is that I'm an attorney, and many people have decided to work, either eliminate their time in the workforce or work part-time, flex time, those types of things. And I'm wondering, as economic realities have made it so that many women have to get back into the workforce, including many of our members. And I'm wondering what, if anything, the administration is doing to encourage businesses to look to part-time, telecommuting, flex time, in order to... particular to find balance for their families.
Well, I'm glad you asked that because it's one of the things I should have mentioned and I left off my list. It's a big issue for us. The First Lady and the President have both talked about it because it's something they've both lived. They were both working parents, with young children throughout their entire careers. You probably heard the story. First Lady often tells the story of going to her job interview, at the University of Chicago Medical Center, having to take Sasha in the baby carrier with her, to the job interview. And so she knows it. So we, in fact, in this very room in March of 2010, held the first ever White House conference on workplace flexibility. And both the President and the First Lady spoke at it. We issued a report that's still being cited by our President's Council of Economic Advisors that laid out the business case. And there is a positive business case. The businesses that have flexible work arrangements, that allow for part-time, that allow for time off, that allow people to sort of on-ramps and off-ramps for their careers, have a better bottom line. They have lower turnover. They have a more productive workforce. They have lower absenteeism. Those are all things that contribute to the bottom line and are really critical. I've spoken about this now globally. Other countries are doing it. So to maintain our global economic competitiveness, this is something that we need to address. So what we've been doing, we launched that in March of 2010. Our Women's Bureau from the Department of Labor then had 10 other sessions like that around the country. They've got a report that they're pulling together on best practices. We've been trying to implement best practices in the federal government be a model employer. So we have enacted a telework. There's a Telework Act that did get enacted and that we've been implementing to try to get telework and other flexible arrangements implemented through the federal bureaucracy. One of the things we've been trying to do is also work with DOD because, like yesterday's announcement, they know they've got a lot of working spouses in the military as well, and to develop flexible arrangements for that. It's a challenge. We would love to sort of hear more input from all of you about what's working, what's not working, what can we do in the federal government to help. It's a little challenge in the current statutory environment, regulatory environment, because it's hard to get new regulatory pieces put through. So what we're trying to do is lead by example and also work with all the coalitions on workplace flexibility that are out there to kind of lift this up and make sure people get the word out. The economic report to the president by the CEA will come out. It's either coming out this week or it's about to come out. It's a big, thick report on the overall state of the economy to the president. But I will give our new chairman, Alan Kruger, a lot of credit. He has a special box, look in Chapter 6 when it comes out, on overall economic trends, and he's got a special box where he highlights this very issue of workplace flexibility as one of the trends that's important to pay attention to as we build our economy of the future. So it's something we're very, very interested in, so thank you for asking about that. So thank you all.
Just thank Tina again, just for those were great remarks. I know you were excited to hear from her. Okay, so it's been a busy morning, and there's always things going on. Just like Tina mentioned, all of us are juggling about 3 to 4 things each day and sometimes each hour. So we're really excited that we've had so many speakers. So we're going to have another panel now. And so not just all women today, but now I'm going to introduce you to my colleague, Kevin Lewis, who is our Director of African American Media and Special Projects. Kevin is going to help moderate this next panel. And we have some speakers from the Department of Education, Tyra Mariani, and from the Environmental Protection Agency. I see you in the back, Stephanie. Ms. Stephanie Owens. And they're both going to highlight issues on education and the environment. And so once again, we'll do the same as before. They'll give about 5 minutes of remarks, and then we'll take question and answer.
Good morning, ladies. You guys look so beautiful. It is just so awesome to look out and see all these beautiful faces. I want to start by thanking you for being here and for congratulating you on being the new face of an environmentalist. I'm Stephanie Owens. I'm from the Environmental Protection Agency, and you're going to hear from our administrator in just a little bit, so I'm going to keep my remarks very short. I focus on public engagement at EPA, and my role is to expand the environmental conversation, to have more people at the table talking about these issues. You've heard about our agency, right? Job killing EPA? Okay. No, not so much. That's not who we are, and that's not what we do. We protect human health and the environment. Indulge me. I'd like for you to reach in your purse and grab, I don't know, something that you can read. Maybe some hand lotion, lip gloss, just anything that has a list of ingredients on the back of it. Does anyone have an ingredient, say the second or third, that has more than 2 syllables? All right. Anybody want to mention what that ingredient is? Absolutely. And what does that do? That's exactly my point. And so one of the things that our agency does is we work on chemical safety. We actually research the chemicals that go into the products that are used, the products that are used to produce food, the products that are used in your cleaning ingredients. And for the first time in 2010, Administrator Jackson put a database of over 83,000 chemicals on the website so that should you decide you want to know what it is you're putting on your face, I'm not preaching, just teaching. Should you decide you want to know, you could actually go on that database and look it up and see how it impacts you. There's a lot of conversation about the work that we do, the regulations that we put forward, and we've done some amazing work, and the administrator is going to talk a little bit about that when she gets here. But at the same time, it's really important for us to begin to provide more education at a community-based level. And I don't mean community as in your neighborhood. I mean community as in the place that you are, where it matters to you, so that you know what's in that lip gloss, so that you know what's in that detergent that you're using, so that you know what it is that you're putting on your table, so that when your child drops something and picks it up and puts it in his or her mouth, then you know exactly what's going on with that particular chemical. One of the other areas that I focus on is environmental education. And I have to really applaud Quay and the work that she's done and the way that your organization has come together behind her leadership. Your support of our release of the mercury and air toxics rule was absolutely phenomenal. You had people talking about an EPA regulation that don't normally have this conversation. Usually it's polarized. So you have some folks over here, and it's all about the earth and polar bears and conversations that folks don't necessarily normally have. And you have business and industry over here saying it doesn't work. And then in the middle, you have everyone else. And this is the kind of conversation that we want to begin to have so that people understand how these environmental rules affect them in their own individual areas. So I'm going to stop now because I want to spend more time answering your questions. And just once again, it's an awesome view from where I sit. So thank you.
Good morning. My name is Tyra Mariani. I'd like to echo the sentiments of Stephanie. It is both an honor and a privilege to sit before you. To see a room full of women of color at the White House is a pretty amazing thing. And I have to say, I'm like a little bit nervous just because I'm so honored to be in your presence as peers. Really, I do mean that. I am the Deputy Chief of Staff to Secretary Arne Duncan here at the White House. As you know, President Obama has made education a major, major focus for his administration. When other agencies are seeing cuts, President Obama is always, always making education a priority and putting more money into education rather than less or even the status quo. I wanted to both highlight some of the things that we've worked on over the last 2 to 3 years, as well as just to give you a sense of some of the things that we're looking for and what the priorities are going forward. Of course, we had the American Recovery and Reinvestment Act, which saved over, I think we had over 325,000 teaching jobs, Pell Grants, and new reform programs that were funded. We also made a major investment in early learning. We just had what was called the Race to the Top Early Learning Challenge Fund. As you know, probably better than I, the variability in early learning, particularly from birth to pre-K, is just all over the place. It's anything from, babysitting to true, children learning languages and things of that sort. And so with the Early Learning Challenge, we really wanted to challenge states to pick up the mantra of adopting standards and thinking about high-quality early learning programs so that children are prepared to enter kindergarten and beyond. So that was also another major investment. We also have tried to support meaningful change at the state level. So one, you may have heard of the Race to the Top, which focus on standards and assessments. prior to what we call college and career ready standards curriculum, state standards were all over the map. And so parents thought that their children were doing well because maybe the standards were dumbed down and they actually weren't. But through these incentives that we've provided, we have 46 states that have adopted college and career-ready standards, and they're beginning to work with a new generation of assessments. So whether you're homeschooling or you have children in public schools, I really encourage you to approach your schools and districts and find out where they are in adopting these standards. And are they being implemented? Are they starting to think about preparing teachers, and are teaching starting to use these standards? And just so you know, these standards are internationally benchmarked. So when kids start learning according to these standards, we know that they will be internationally competitive, which is a great move. We're also focusing on turnaround. So our bottom 5% of schools, which represents over 1,000 schools across the country, we call them dropout factories when it comes to high schools in particular. The president has made it a priority through the school improvement grant that we focus on turning around these low-performing schools. So it requires the introduction of new staff, including principals and teachers, new curriculum, and also thinking about adding learning time, because we know that our kids, sometimes the 6 hours isn't enough, and it can be through enrichment and other programs, but we want to make sure that our kids have what they need to go forward. We're also trying to make college count. So this isn't a K-12 agenda, but we also have really focused on Pell Grants and making sure that post-secondary students have access to Pell Grants. So since 2009, I'm happy to say that Pell Grants are up by 50%. So instead of 6 million students having Pell Grants, we now have 9 million students that have access to Pell Grants. And then also the percentage of young adults with post-secondary degrees is up 2% to 42%, which is not nearly enough when you consider the president's goal of us becoming the leading nation in terms of producing post-secondary graduates, but it is a start. And the other thing that we've been focused on is really transparency and helping parents and students make informed decisions around what does college really cost, right? What am I going to learn, and what kind of jobs are the graduates of these colleges getting? And so we've really been pushing a transparency agenda, thinking about a scorecard, an easy-to-read scorecard that allows parents and students to understand what value they're getting for the colleges that they're going to. Going forward, we are continuing to focus on college costs, both continuing that federal support that I talked about through Pell Grants, but then also state reforms. So we're really pushing states and colleges to think about making college affordable and of value, of a high quality. And then we're also focused on freezing the subsidized student loan interest rate. It's currently at 3.4%. It's supposed to double later this year to 6.8%. So you can imagine that's something that we want to fight against in the economic times that we face. And we're also really focused on teachers. So we realize that our teachers are nation builders, right? They are perhaps one of the most important professions. And, we realize today that the role is so important, yet teachers don't feel respected. And the way that we think about the profession is, we want to negotiate 15 minutes in every given day, but we realize that teachers are professionals, that they work way longer than the 8 hours than the contract may say. And so the president has called for, he's actually proposing $5 billion in the FY13 budget that really encourages states and districts to think about transforming the profession. And so this includes anything from not only thinking about paying teachers more, and so it should be a competitive wage that students graduating from college consider teaching along with engineering and accounting and every other profession that's out there. So he's calling for an increase in compensation. But then also that the school place that we consider collaboration, that teachers have career pathways, so you shouldn't have to leave the classroom in order to make more money, but you should have other, ladders and roles along the way that allow you to stay in the classroom. We realize that great principals are equally important, so we want to make sure that we're investing in the preparation of our teachers and our principals. And so these are, one of the reforms is just really focused on the teaching profession as a whole. How do we transform it? We look at a silver bullet. We want to look at evaluation systems, but it's so much bigger than that, and we realize that. So we're calling for $5 billion to incent states and districts that really move towards thinking about transforming the teaching profession. And then finally, the other priority is jobs, aligning job training and education programs with workforce demand. The president has called for $8 billion in mandatory funding for Community College to Career Fund, and if you saw the State of the Union address, you may remember him mentioning the need to really align what we're preparing adults to do and the skills that are needed in the economy. And so he's proposing for $8 million for community colleges to really work with businesses in the community to align that need that's happening. And the final thing I'll say before we open it up for questions is that we can't do anything without parent engagement. It's one thing for this to come from Washington, and we're going to continue to push for what we think is the right thing. But if we don't have parents demanding a better education, better schools, right, better districts, we're just not going to get there. And so we both want the voice to come from the ground to make it better, but then we also want to do what we can to help parents be informed decision makers and figuring out what the best schools are for their kids. So as someone said earlier, we can't do it without you, but what, I think your presence here says a lot around parent engagement and education as a whole. So that's all I'll say, and then I'll open it up. Should we?
Perfect. Thank you so much. Want to moderate? Want to help out here?
Thank you.
Welcome, everyone. Okay, we're going to start with a question. Who's going to get it? I have a waving hand in the middle. Okay, here we go. Waving hand. Please say your name, chapter.
Good morning, good afternoon. My name is Emma Dashiell Charles. I'm from Johns Creek, Georgia, and I'm representing the North Fulton, Georgia, Mocha Moms. But most important, I just want to say I'm so thankful and blessed to be here today. I'm a mom of 3 boys, and my boys are so sharp, straight A's, advanced levels. Their ages are 6, 9, and 11. I live in one of the most affluent school districts in Georgia. However, as far as diversity is concerned, this is coming toward education. In our neighborhood and in our schools, although my children are doing extremely well and they're even advanced, I find that we still have a challenge and feeling like I'm keeping up. And our school is predominantly children from China. They're first generation here, but from China, children from Japan, and even children from India. And I find that these children are entering kindergarten. My little guy is in 1st grade, but even in kindergarten, they're entering maybe speaking 2 or 3 languages. So you said, yes. Which I love my children, but they do not speak 2 or 3 languages. So you said something that piqued my interest. You said that you have international benchmarks that you're enforcing. Where can I find more information out? Can you about that? Can you share more? Because I need to know. I need
to know. So as I mentioned, that 46 states have adopted college and career ready standards. Don't ask me which state. I can't remember off the top. I think it's Texas was one that wasn't adopted, and. But anyway, 46, the good news, have adopted these college and career ready standards, and the standards are internationally benchmarked, meaning if children are learning according to these standards, we know that we will be internationally competitive as a country. If you Google what's called Common Core standards, that will tell you exactly which states are a part that have adopted these standards. and then you should inquire within your particular district or school where they are in terms of adopting the standards. So that's the gist of it. And then there are also 2 consortium that have been developed. States are usually one of the 2 that are also working to rethink the assessments so that students are prepared. We know that today's assessments aren't of high quality and aren't measuring important skills like critical thinking. And so we have 2 assessment consortium that have been formed to align to the Common Core curriculum that's more competitive. So again, Google Common Core standards, and you can also get a sense, they actually have the standards online. So if you want to look at what students should be learning in language arts and math by grade level, the standards are available for you to see. And then again, you can check, it really varies by district and by school in terms of their plan for implementation. But you definitely, again, that parent engagement piece, you want to push, where are you guys in adopting these standards? Are my kids learning? When can I expect them to adjust to these new standards?
Okay, so we're going to take an EPA question now. Environment. Okay. All right, there we go.
My name is Tasha Fuller. I'm with the Woodbridge, Virginia chapter of Mocha Moms. Hi, ladies. My question is an environmental question. I have a very green child. I don't know where I got her from. And we're all into the environment and recycling. But one thing that I've noticed, and it's an education and EPA question, is that when you go to the schools to volunteer, they're not recycling. They're not teaching sustainability. They're not composting. They're not doing any of the things that we need to do in order to make our world a better place and a greener place. And I've also noticed on another end, we just happen to be fortunate when you're a stay-at-home mom, you have a couple of opportunities available to you. But when we travel to other areas and visit our families, our neighborhoods don't look like their neighborhood. Right. They don't have the same resources going into their neighborhoods to actually keep it clean. And I'm wondering why that is. I mean, we're all paying taxes, we're all, living in America, and I should never go to another neighborhood or have to take my child to their grandmother's house and see trash all over the street. I mean, what's up with that?
What's up with that?
Yeah, what's up with that? So.
Thank you for your question.
First of all, I'm excited about the question about the schools because you're absolutely correct. And last year, Administrator Jackson and Secretary Duncan created an initiative. It's called Green Ribbon Schools. So that initiative actually focuses on bringing more environmental information into the schools in a voluntary way because the teachers are very busy, and you can talk to this, teaching to test, and their budgets are cut tremendously. And someone mentioned earlier that even things like recess, where children don't have an opportunity to do that. So there's a limited amount of time that the teachers feel as though they have, and it's the limited amount of money that the administrators of those schools feel that they have. But through this initiative, EPA and Department of Education are working together to identify schools across the nation that will then be given green ribbons as these green ribbon schools, and hopefully that will become a model for a very easy and voluntary way to incorporate some of these green activities into the school setting. On the inequality of community maintenance and solid waste is basically the question that you're asking about. So the federal government, we set up federal regulations and we provide funding to states, who then provide funding to counties, who then provide funding to cities. And it's that flow that often causes the disconnect in terms of what actually happens from one community to another. So the federal policy, our federal policy on solid waste is the same in all of the states, but what states are funded in which ways and how that moves down to actual local government and what they're able to do, that's all a local decision. So these kinds of conversations are the kinds of conversations that you would have with your local municipalities about the issue that you're raising. But from a federal level, the regulations are all the same. It's just how they're implemented at the local level that's always different. Did you want to add to that?
Okay, we're going to switch back over to education.
She set it off.
Okay, the waving hand all the way in the back. We'll go. Yes.
Hello, my name is Cree Davis, one of the presidents of Atlanta South Fulton chapter. And I want to say thank you for recognizing that Mocha Moms is a powerful grassroots organization. Make things happen. Mocha Moms is a very strong organization. But I have a plea. I have a nonprofit organization, as another one, Big Sis, Little Sis, Inc. And one of the things that we've incorporated is help with breastfeeding. We've heard today about health care, education, but all of that really starts from a baby with breastfeeding, which in our community, I'm pretty sure most of us in here have breastfed, because we have that education, or we're at that level. But I'm standing here for the girls that are in my organization who don't have that chance. And my organization is their chance. We teach them how to breastfeed, literally with our hands. Is there a way we can use media, commercials, the way McDonald's pushes burgers and fries on our community? Can we use that same effort and push breastfeeding? Can we use that same effort and push how important education is in a fun commercial to the kids, that are in our communities, some of the rough urban communities where the children are sitting there watching TV all day because mom is at work? This can feed into them as well, and the more they see it, the more their minds will be renewed. So is there a way we can do that? Is there a way you all can use more of the media as far as commercials to push some of these things to our children in the rough urban neighborhoods?
The answer is yes, and only because I still see her sitting here. I'm going to punt back to because really it's very appropriate for Dr. Nadine to speak to how, with her work at the Department of Health and Human Services, and especially her work with disparities, and I'll just tell you, HHS does amazing PSAs. The CDC does amazing PSAs, and so I absolutely think that there's an engagement activity that could happen, and I think that that's sort of square in your area, Doctor.
No, please, of course.
So yes, I think that the influence and the use of social media is amazing. Social media, mainstream media, for us to get these health messages across. We have actually a program called Text for Baby, because we know about the usage of cell phones, for example, high usage of cell phones. And this is a free service, actually, where you can get text messages sent to your phone if you are pregnant. Actually, it'll tell you in the course of your pregnancy, okay, it's time for this test, so you should be going to see your obstetrician. What's it called? I'm telling you right now. womenshealth.gov, or you can actually just go to Text for Baby. If you just Google Text for Baby, you'll find it. But our womenshealth.gov, which is our Office on Women's Health, you can get this information. And it continues actually after you've had the baby as well, so that you know it's time for the 2-month checkup. It's time for the baby to get these vaccines. It's time for the 4-month checkup. This is a great tool because we know the high usage rate of text messaging. These are some of the innovative ways that we are trying to get health messages out there, besides just expecting that you're just going to get that in the doctor's office by and having routine care. But we're tweeting, we're blogging. The Surgeon General is doing this as well. So there are those mechanisms. If you go to my office's website, which is, you just again, Google Office of Minority Health, or it's minorityhealth.hhs.gov, but you don't remember all that. Just Google Office of Minority Health at HHS. You can sign up for many of these things to get information, but certainly Text for Baby, if you haven't heard about it, please spread
I
that
just
news.
wanted to add that Text for Baby has already reached out to us, so it's in the works.
Okay, great. Okay, so I feel so bad. I feel so bad. Okay, so I was just looking at Twitter, and John Carson, who is our director of the Office of Public Engagement, he tweeted, "Hey, I'm coming down to speak to the Mocha moms." So he's here. I definitely encourage you all to tweet. If you have, I saw you have about over 3,000 followers. So for the folks who aren't here, if you can, start the dialogue. I'm going to call up John Carson right now, so you can go over some more.
Good morning. How's it going so far? Had some great people come by, learned a lot. Well, look, I am just here to first, as many others have said, say welcome to the White House. But they sent me up here with an ask of all of you. But it's an ask that I know this is a crowd that is very good at. And that is, tell your story of what you experienced here today, what you learned here today, what you learned from each other, what you learned from administration officials. It's very fitting that I'm making this ask after the exchange that just happened, because here's what I have to tell you. I work on public engagement. My job, what wakes me up in the middle of the night, is how we can make sure more people understand how the federal government can be a partner with them, with their organization, with their community. And here's what I have learned. The New York Times is wonderful. The Washington Post runs a decent story now and then. But I'll tell you what, the number one way that people find out what is going on in this country, how they find out how the federal government has something that can help them, is one-on-one conversations. It's that blog posting. Look, I know the power of what Mocha Moms can do. My wife and I, wherever we've moved, we're on the local mommy blog. We follow. That's how, and when we're busy, when some pediatrician that we've never met on that listserv says you really shouldn't be using this formula, you should use that one, we just go with it. That's how the Affordable Care Act, right? You've talked about it this morning. Here's what I want you to understand. The number one way that people have found out how it can help them, that website they can go to, is not some New York Times or Milwaukee Journal Sentinel article about the politics of the Affordable Care Act. It is one mom sitting next to another at a basketball game saying, I just got my 22-year-old on my insurance. Have you done it yet? These are not extra things. Tweeting is not some nice side thing that happens. This is the number one way information moves today. So my simple ask is talk about what you liked here. Talk about what you didn't like. Talk about the information you learned. But for two different reasons. First is for the information that you will share. The collective power, the collective networks of this incredible group of community leaders will reach more people than the president's trip to Milwaukee, Wisconsin yesterday. But there's a second reason that I ask you all to be so vocal, tweeting, writing, blogging, pull someone aside at the grocery store tomorrow, is that what we need in this country right now is more people understanding and believing that we can make our country better and stronger, more people believing that they can be a part of it. And when they see that a community leader like you, that they know, that they're on your email list, that they've seen you at work, when they see that you were at the White House, you were a part of making change happen, they're going to believe that they could be a part of it too. So be vocal. Tweet me. I am at John Carson 44. We're going to be doing a Twitter session with a number of you later this afternoon. I look forward to it, and thank you so much for what you're doing every day. With that, I'll turn it back to Kevin.
Okay, and we have another guest. Okay, so we're going to take a couple more questions. Before we continue, since there's so many great, I see all the hands shaking. I just wanted, can you take the opportunity just to share your contact information so if any of the Mocha moms have questions for you, they can reach out to you directly?
Sure. It's Owens, O-W-E-N-S. Owens, O-W-E-N-S. Stephanie, STEPHANIE, at EPA
mocomoms.gov.
And I'm not a tweeter. But you can have my email address, which is tyra.mariani. I'll spell it for you, but if you have it on the agenda, it's tyra.mariani@ed, as in ed.gov. So tyra.mariani@ed.gov.
Okay, so we're going to take one more question. Okay? Two more questions. Time for two more questions? Which one? Okay. Okay, so we have two more questions. Oh, see, how could I not? You see, okay, you see, this is what I'm talking about. We're voluntary, it's a collective. All right, here we go. How could I say no? She's shaking.
I'm Akila Jefferson, co-president for Southern Prince George's County chapter of Mocha Moms.
Welcome.
And I so value education. I'm actually an instructor at a local community college that's doing workforce development. So helping, and I'm over here in Southeast DC, helping people, learn a craft, learn a skill, get back out there. My question to you involves how the administration addresses the individual needs of our students. So as opposed to, we've kind of, over the years done it because we've done it that way, have a factory model of education. How are we addressing those individual needs, supporting specialty programs in, Mandarin immersion schools and things like that within our public school system? So that's my question.
Thank you.
That was a great question. So absolutely agree with you, and I talked about the need to transform the teaching profession. It's because you said earlier, I walked in, that we're not preparing our kids for the kind of jobs that we were prepared for. It requires a different kind of preparation. It's really a local decision in terms of what kinds of schools, and so we certainly are promoting states and districts to create a different portfolio of schools, and that's not necessarily charter or traditional school, but that is the Mandarin immersion program, that's career academies, that's really places with really small class sizes, or maybe students with disabilities. And part of this standard is saying, developing the Common Core curriculum, which we didn't do, states have done, is to define what we think students need to know and be able to do. And so our funding, whether it's through Race to the Top or school improvement grants, have really pushed states and districts to come together in terms of deciding what students need to know and be able to do, but allow teachers to decide, along with parent engagement, what's necessary for those students. And one of the things that we're really encouraging and have put out is a technology plan to say, we realize that student learning is individualized, and technology is a great enabler when you're in a classroom of 20 kids or 30 kids or more, that you can really leverage technology to look at individualized student needs. And we're also supporting collaboration with teachers, because we think that it's through teachers talking about students that you can understand student needs. If you just put that teacher alone in the classroom and you don't give him or her time to talk to other teachers about, Johnny's really struggling with this, or Sarah's really acting out, I don't know what's going on, and that through that collaboration you can sort of figure out what the student needs are. So I'd say that our incentives and even our ESEA flexibility, so No Child Left Behind, really strict and mandating and punishing schools, but allowing states to come up with accountability systems that look at different needs of students and how they're performing, including subgroups, so that they can meet those needs at the local level.
Okay. Please.
I'm Shelley English Figueroa, and I'm one of the founders of this organization. Of my life, and this is a dream come true. Thank you everyone for this. I have a question.
The little boy who was 4 years old, my son, who was 4 when we founded this organization, is now a man. He's in college.
Wow.
Look how long we've been doing this. I'd like to know what explanation have the colleges given you in terms of their justification for their prices. We just went through the college admission process. He's a freshman now, and the average college is $52,000 a year.
Yeah.
We really ended up basing our decision in terms of where to send him on pure finances, because we simply couldn't afford to send him to some of the colleges that he got into because they were $52,000, $53,000, $54,000 a year. And many Mochas don't have children as old as I do. But I want to know, what have the colleges told you? What explanation, what really can be done? Thank you.
So part of the issue has been state aid to colleges, and that is with the economy taking the hit the way it has, state budgets have decreased what they have given to those colleges and universities. And so colleges and universities have then passed that cost on to students, right? And so we've really focused through the Pell Grants trying to give more aid, but that's not enough, because then you're almost sort of, I don't want to say contributing to the problem, but you're helping students to pay for it, students and parents to pay for it, but it doesn't help if the cost keeps going up. And so a really major push, particularly over the last several weeks and going forward, is offering, thinking about a competition, thinking about the aid that we give to states so that they can start to think about how to make college more affordable, and really incenting and giving tuition and scholarships to places that are giving a real value, to your point of, like, I've got to make a decision and their trade-offs. I'd say, but to answer your question, the primary reason has been around reducing state aid to colleges and universities and having to pass that cost on. But I think relatedly, colleges and universities really have to start thinking about how they do things differently. And so personalizing learning at the college level is also equally important, and thinking about online learning and other ways of getting that information out. So I'd say one of the current pushes of the administration is really making colleges and universities rethink how they deliver what they're teaching and delivering it so that it's a value to schools.
All right, and I know this is going to be a lightning round. I feel so bad on that side. I have to do it. I thought she was going to, although on the side, I'm sorry. So last question for real, this side.
For real.
My name is Shoshana Bignier, and I represent the Essex County chapter in New Jersey, where, so I actually come on a couple of different fronts. I come as a Mocha mom, but I come to you all asking questions both as a teacher and as a mother and as a parent. No Child Left Behind is a hallmark of the Bush era, and it was the first of its kind to establish benchmarks for schools to hold teachers and administrators accountable to promote achievement for all students. So I love that. So for everything that's been said about it, I really appreciate that there's being ratification to it to make it better. Just before I get into the next part, I want to big up Obama for being a part of the public service loan forgiveness. I just want to say, if you don't know about this yet, you need to know. It allows teachers, childcare providers, and other service individuals to stay in the professions. And for somebody who came out of college having $50,000 in student loans, I'm only 2 years away of having forgiveness. I unfortunately come brokenhearted knowing that the policy needs to be amended in terms of No Child Left Behind, because I'm now back working in Newark, New Jersey as a literacy specialist. And I firsthand witnessed the pain and humiliation of a 5th grade student forefront of our kids at the early childhood education level to minimize special education budgets that come later down the road. And you talked about race to the top, which is largely based on test scores. And I'm here representing all of you, knowing that the gap starts long before our kids ever take a test. What is being done to hold our communities accountable for our children, not just the parents and the teachers. And in terms of like, I know you said a lot, you said something briefly about the early learning challenge, and I want to know where to get more info for that, because now that I'm back in the classroom and I'm working with teachers who are absolutely dedicated to these kids, there's so many teachers out there that are trying to stay in this profession. I could have gone on to be a lot of other things, but I believe in our kids, I believe in my kids, I believe in your kids, and I believe that I didn't come through school going to the best private schools. I went to schools at some of the worst public schools, but I turned out here in the White House. So I'm urging you all to make our public schools work. Even though many of us are affluent and we have the opportunity, advocate, even if your children are in private schools, advocate for your public schools.
So thank you very much. Wow. That was, I think we have to say that we're all inspired by the fact that you sat there, you listened to everything that the speaker said, you realized how it related to your life. And that's what makes everybody here in this room work as hard as we do every day. And understand that that message, that passion that you have, the tears that you're shedding, our president understands that. And that's why he employs us to work as hard as we can to make sure that you have programs like the Public Loan Forgiveness Program. So just know that. Just know that. And so, you know, I have the pleasure of working with Michael Strautmanis. And a lot of times, people here in D.C., they call him Straut.
Wait, you're not going to do this. I thought I was going to come. Well, first of all, we'll get you answers to your questions.
Yeah.
So you can get the information you need. So we will do that. Sorry. I knew you were going to do that anyway.
Yeah.
We'll get it. I can't stand here while you do that.
He's just gonna drop by to say some few words. He heard you ladies were in the building today. He's actually on travel, but wanted to stop in and say some brief words. But your, passion, I just had to address it and say thank you. So we're gonna make sure Tyler does answer your question, but I'm gonna allow him to give some brief remarks so he can be on his way.
So these folks, they work for me, so they have to let me come and speak. So I'm going to interrupt briefly because I wanted to come by and say a couple things. So my name is Mike Strautmanis. It's great to see everybody here. How you doing? I want to just say a few things that I want you all to know. Valerie, Jarrett, and the president are on the West Coast, but they would want me to say the following. Number one, we cry a lot around here. We do. Because it's a tough time. I might say I'm getting choked up right now. And my team who works for me know that I'm a big crier. But it's because we care. And it's because our emotions and why we get up every single day are wrapped up in this. The other thing I want to just say, particularly just specifically for the Mocha moms, is that, we see you. My mentor and the first person really professionally who looked out for me was Michelle Obama, the First Lady of the United States. I work for Valerie Jarrett. She's my boss. I see her. We meet 3 times a day. We email 150. She's on that email, Jack. You know, between my mom and my wife and my daughter, these amazing sisters that we have here who are incredible, who are doing exactly what you're doing, but just in a different setting, who are juggling exactly what you're trying to juggle to manage their parents and their families and their communities and their professions and their children and everything else. I guess I just want you to know that what you're doing and the way you're doing it, just that's the way it's supposed to be. Don't let people make you feel like you need to change somehow how you're doing what you're doing in order to fit into some notion about what is success and what this country is supposed to be about. If there's nothing else you should take away from this, know that the way you operate, the way you roll, is happening at the highest levels of the United States of America, right? The president is trying to, you know, do his job and be a good husband and be a good father and take care of his health. His wife is doing the same thing, but as I said about Fred Astaire and Ginger Rogers, on heels backwards. And so, and that ethic and that faith and that determination to do everything right the way you all do. Looking at you, I think about my wife, her determination to do everything right and have everything happen at the highest standard. That's how they got to where they are. Nobody gave them anything. Nobody gave you anything. So as we continue to do this work, as we try to accomplish what needs to be accomplished in order to make sure that we have an economy that's built to last, that has opportunity for everyone, just know that we're going to need you, not as supporters. Yes, we're going to need you as supporters, but we're going to need you as guides. We're going to need you as inspirations. We're going to need you as innovators who can show us the way things are going to work well in the community so that we can do the same thing and have that reflected here. So this is a real partnership. That's why we did this, is not to start something, but to reflect what is and to reflect what has already happened and to affirm you and to affirm us, because this is why we do what we do. So I just want to thank you for the spirit and the energy that you brought into us. This place has been crackling all day. I saw some of y'all coming in as I was going into work today. And you all were crackling on 17th Street and Pennsylvania Avenue, talking to each other, and I'm going to tell them this, and I'm going to say that, and, you know, I'm going to do this, and you all had so much energy around governing, right? Around education, and around an economy, and around healthcare, and around our environment, around what's real. So yes, you know, Jay and B, they had their baby, and I know that's important, and we got to talk about it. And we lost Whitney, and that was a tragedy, and I know we want to talk about that. And what our children are wearing when they're in school and all that stuff, you know, yes, I want to talk about that. But I want to talk about this too. Thanks a lot, everybody.